All right. Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Lymphatic Health and Wellness Essentials. Before we begin, if this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and education programs like this workshop. Education programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, I'll introduce our workshop speaker. Alex Villanueva is an occupational therapist and certified lymphedema therapist, currently serving as the owner and lead therapist at LymphaVilla. Inspired by his mother's breast cancer and lymphedema journey, Alex is dedicated to providing compassionate care and promoting greater awareness for all aspects of lymphatic health. For more information, please visit his website at lymphavilla.com. Thank you so much, Alex, for joining us, for being here with us today.
Awesome. Thank you so much for inviting me. I'm really excited to chat with everyone. Thank you, Cancer Support Community South Bay, for inviting me to come chat with everyone. I'm an occupational therapist. Well, my name's Alex. I'm an occupational therapist and certified lymphedema therapist. Two things I like to joke that no one knows what they are at all. Essentially, what I do is I work in rehab, like particularly outpatient rehab, and I help individuals who are dealing with various maladies that maybe contribute to chronic, swelling, that kind of thing. So without further ado, I'm gonna share my presentation. And like I said, I definitely want questions. I will say though, I'm not a doctor. I can't diagnose you, but I'll do my best to give you my opinion. Okay, just hang tight. And where is it? Technology is not my strong suit. All right. So again, this is Lymphatic Health and Wellness Essentials. Again, my name's Alex Villanueva. We'll go into a little bit of what we're going to be talking about today. So I'm going to talk about who I am, what I do, the role of your lymphatics, what is lymphedema, and also lipedema, lymphatic drainage basics, helpful tools and insights I've gathered just from working with so many wonderful patients, and then we'll have a Q&A. Again, if you have questions at some point throughout this, feel free to drop a line. I'll do my best to answer it in a timely manner. So a little bit about my credentials. I got my bachelor's degree at UCLA. I got my master's degree at Cal State Dominguez Hills in occupational therapy. I've previously, prior to getting to lymphatic health, I was working in various skilled nursing facilities, working with just a pretty wide patient population. And then prior to opening my clinic, I was I was acting lymphedema therapist at both Henry Mayo Newhall Hospital in Santa Clarita and Glendale Memorial in Glendale, California. And then currently I'm the owner and therapist at LymphaVilla. So let's get started a little bit about what lymphedema therapy is, because oftentimes I have individuals come into my office or come into my my treatment room really not knowing what they're there to get evaluated for. And that's a big reason why I started this. I reached out to cancer support community to have this kind of conversation, because the reality is when it comes to all things lymphatic health, it's the information isn't streamlined exactly. Even amongst like healthcare professionals and again, the general public, these are topics that aren't really always really talked about too often, and I feel like there's different pockets of knowledge. So, I'm trying to just provide, again, a little bit more of a streamlined experience, kind of explaining, what this process is like, things you can do to promote your lymphatic health, and then, again, trying to think of there's a lot of things we could use in our toolbox to help manage symptoms. And just to touch on one thing, I spoke with individual earlier today, and her story just, it's shocking and not shocking at the same time. She was telling me how she's had breast cancer 4 times, and one of the questions I asked was, hey, like, have you ever gotten a compression garment? Have you ever worn anything? Because she was having swelling symptoms, and she was telling me, no, no one's ever referred me to anything. I've never had lymphatic drainage, and it's just a story I hear very, very, very often that, I feel in this day and age shouldn't be the case, especially with just how much information and now even legislation there is, which I'll go into a little bit, that supports individuals with lymphatic health issues. But without further ado, so with lymphedema therapy, it has several components that, like, collectively put together, promotes basically unblocking your lymphatics, which oftentimes when you have that kind of swelling, there is some issue further up the line that is likely blocking it. So one of the main things, and this is something I really enjoy doing, is called manual lymphatic drainage. So manual lymphatic drainage, layman's, or it's lymphatic massage, but lymphatic drainage is basically a gentle technique that allows you to basically stimulate the adjacent lymph node chains. You have lymph nodes all over your body, around 600 to 800. And with that, we are moving that accumulation toward those simulated lymph node chains for it to drain and go through its, the appropriate lymphatic vessels, eventually to like your thoracic duct. And again, just the process begins anew. Compression therapy. Compression therapy is also a very important component for managing for just promoting better circulation. I have friends who are working in like hospitals, like nurses. They wear compression garments pretty often because the reality is that, labor intensive, on your feet a lot, from when you're using these things a lot, you get swelling. So things like compression sleeves, there's short stretch compression bandages, and compression pumps. These are all things that we have that can help manage symptoms. Home exercise programs. So most of these exercises are very focused on really just trying to promote any movement. Lymph doesn't really move on its own. It's through like smooth muscle contractions. And in that regard, like just, with contracting and relaxing really helps promote movement. So, you might hear, you might see like people, especially with the new age of working from home, people who have swelling in their legs from sitting at a desk all day, that's not by accident. That the reality is when you're not moving, your legs are, your body's not able to move the lymphatics out. It optimally should. And the last thing is something that I think doesn't get talked about enough, but it's like lifestyle management. With lymphedema and individuals with lymphatic health issues, the reality is, even though there is no cure per se, there are a lot of things that we can do to hopefully mitigate how much swelling or how many issues that you may be having. That includes diet, that includes, knowing when to wear your garments, also even things like the weather outside. So hot weather promotes swelling, things like jacuzzis, saunas, those kind of things promote swelling as well. So that's why it's just continued management, ideally collaborating with whoever your lymphedema therapist is, and, just being a strong advocate for your own health, because that's a big part of how all this works. This just gives you an example of what really kind of tangible impact lymphatic drainage can have, and lymphedema therapy. This is from one of my patients. This is posted with her permission, but she's been dealing with, she has what we call chronic venous insufficiency. Essentially, the fluid return back to the heart, especially in her legs, is a little bit weak. So she tends to retain fluid in her legs. So as you can see, starting from the picture on the left here, this was on our first session. Very uncomfortable. She has trouble putting on shoes, pants, and she just gets tired very easily. It impacts your balance. And just after several sessions, we can see how it's a gradual process. This is not something that happens overnight, but again, through a continued team effort of managing symptoms. And then on the far right there is about a couple weeks ago, and she's feeling a little bit lighter, easier to move. And, again, it's really, that's probably what I love most about this job, just seeing how it improves one's quality of life through, this collaborative, but, it's a demanding effort. But I think with the right kind of care, it's very much worth it. And again, just as a note there, everyone's recovery journey is going to be a little bit different. It's impacted by a lot of things, even if like you're a former smoker, if what's your age, what's your medical history, even medications, because medications can often promote swelling in their own ways. But yeah, just worth mentioning that. I have a small short video here from the Cleveland Clinic. It's just going to go over some basics about how your lymphatic system works. So there we go.
Imagine that the inner workings of your body are like a bustling city. Your heart is similar to a power plant, supplying you with energy, and your blood vessels are a highway, constantly transporting that energy to your entire body. But inside your body, as in any city, there's a lot of waste to deal with too. And that's where your lymphatic system comes in. You can think of it as your body's sanitation system. Your lymphatic system is made up of a network of tubes called lymph vessels, which carry a clear liquid called lymph fluid throughout your body. These lymph vessels are like streets and alleys where garbage trucks stop to collect waste. Except in this case, the garbage trucks are the lymph fluid itself, which flows from place to place, collecting waste, excess fluid, and any other unwanted substances. But where does it all go? Your lymph fluid makes its way through your lymph vessels and arrives at your lymph nodes. They're like waste treatment centers all over your body. Most cities only have one big waste treatment facility, but your body is really committed to cleanup. You have about 800 lymph nodes, everywhere from your head and neck to your abdomen and knees, all working to filter your lymph fluid from bacteria, viruses, and other harmful substances. Your lymphatic system also includes some of your organs, which are each responsible for specific waste management tasks. Your tonsils, for example, filter out germs you breathe in through your nose or mouth. Your spleen, which is a tiny organ just above your stomach, filters your blood and makes white blood cells that protect you from infection. And then there's your thymus gland, which is located between your lungs. It's responsible for making special white blood cells called T cells that, you guessed it, help your body fight infections and disease. Just like real-life sanitation services are critical to keep our cities functioning well, your lymphatic system is an essential part of your overall health and well-being. It's a cleanup service, a drainage network, and a defense mechanism. And it works hard to keep you healthy.
So as you can see, with this really cool picture on the left, that just shows you what the lymphatic system looks like. Look how large and expansive it really is. What's also interesting about the lymphatic system, it's more superficial. It's not as deep as like your muscles and cardiovascular system. This is a little bit more superficial. So that's why when we do things like lymphatic drainage, which again, I'll go into a little bit more. Like it takes a lighter pressure. It's not like a deep tissue massage. It's not necessary because your lymphatics, again, aren't as deep. But no, that's a great video. And essentially, here's the role of like your lymphatic system. So it manages like fluid levels. As the video pointed out, it's like your sanitation workers. The lymph nodes are really the lymphatic organ that really stands out that everyone kind of recognizes. You may notice pretty often, or you may notice if like you kind of have a cold or something, often people notice behind their jaw. They have, you have lymph nodes there that can get a little bit swollen, and basically it signifies that your body is probably fighting something, but also signifies that, hey, like your body's trying to fix the issue as well. And that's why it's important to just kind of pay it. It's nice because they're so superficial. That's why you're able to palpate them, touch them. And again, you have them all over your body. You have them below your neck. You have them in your armpits. You have them by your groin. They're all over, again, all with drain or like filtering through lymphatic, like cellular waste. And yeah, so that is what it includes: interstitial fluid, water, salts, hormones, lymphocytes. Again, it's obviously it's a lot of things that are in it. And that's why, as you can see, especially with things like cellular waste, when you have this fluid that's, say, like remaining in part of your body for so long, so say like in your feet, you have very swollen feet for a long time, your body's holding that gunky fluid that we really need to try to clear out and renew, because again, it's fluid that isn't healthy, or it's that lymph isn't necessarily healthy. So that's why we want to move it toward the lymph nodes to drain and process and really look for like bacteria or whatever is going around. This is one of the main things I treat. It's called lymphedema. So lymphedema is a chronic, it's a lymphatic health condition where people get swelling as a result of several different things. One of the main ones being like lymph node removal or lymph node dissection with individuals going through, say, like various cancers, including breast cancer. When you essentially touch the lymph nodes of a certain area, like surgically, how I look at it is you're kind of disrupting the homeostasis of that lymph node chain. And from there, you become very much more vulnerable to developing these, as you can see in these pictures here, just pretty significant swelling. Of course, this isn't to scare you, just to give you an idea of how it can develop if it isn't addressed earlier on. There's different stages to lymphedema that we'll talk about in a little bit, but basically it's by size. So, if you feel a little bit like achiness, a little bit of tightness in your arm, that could be significant, could be something to pay attention to address. But again, I think the key point to take here is lymphedema is something that can be managed. It takes, again, it's a collaborative effort for helping reduce those symptoms. Things like fibrosis is something I see in a lot of some of my patients. Is essentially, it's like kind of thickening of the skin. Again, we're talking about how that fluid that you're retaining in your limbs, it's not the healthiest. So what it can do when you have this unhealthy fluid just hanging out in your arms and your legs, it impacts the adjacent skin, because again, you have some impurities in there that aren't draining, so it could basically thicken the skin a little bit. And when you have that, it leaves you open for various issues, basically decreasing the skin integrity, which, as you can imagine, leaves the door open for developing various infections and things like that. So that's why it's really important to be very proactive if you're noticing these kind of issues, because it's not something that necessarily just goes away on its own. And as you can see, it could restrict your movement and really just impact how you go about your day-to-day life. Here are the stages of lymphedema. Sometimes listed stages 0 through 3, but essentially at stage 0 or 1, it's more of like, it's very latent. You maybe feel it from time to time. Again, it's kind of starts with like achiness, tightness. Often when people, I think according from a lot of my patients, while they're sleeping, they kind of notice a little bit of that. Stage 2 is when you kind of have a little bit more swelling that's a bit more visible. And by elevating it, it kind of the size changes. And then stage 3 is when it's getting a little bit more severe, as it becomes much, much more noticeable, and it doesn't really just go away through elevation. And then stage 4 is, as you can see, it can be pretty significant. It could show in many different ways. Often people sometimes get what we call like lobes, just basically big pockets of swelling in their skin. So obviously we don't want to get through that point, but again, it's just about getting the appropriate healthcare needs met to manage these symptoms. This is a fact that's by the Lymphatic Education and Research Network, that lymphedema impacts around 10 million people in the US. And again, like it says here, more than HIV, Parkinson's, MS, muscular dystrophy, and ALS combined. Which, again, not suggesting this is more dangerous or anything, but it just shows you how prevalent this kind of issue exists in our society. And what I hope you all take away from this today is basically just spreading the word that, one, that these kind of issues exist, and two, that there is care out there, because the reality is, from someone who's been on the front line seeing how lymphedema progresses, we need more advocates. So that's my what I challenge all of you when you leave here today. Now we're going to talk a little bit about lymphatic drainage. This is a video by the National Lymphedema Network. So just a couple minutes, and after this, I go through the presentation, I'll turn my camera, I'll share my camera again, and we'll kind of walk through a little bit more lymphatic drainage stuff. But here you go.
In this section, I'll talk about MLD specifically. Manual lymph drainage is a gentle manual technique designed to reroute lymphatic fluid around blocked or inefficient areas of your body. It combines gentle stretching of the skin along with deep techniques such as breathing to stimulate your body's own natural lymphatic function. During a typical MLD session, you'll be asked to get changed into a gown and be covered with sheets and lay down on a comfortable padded table. At that point, your therapist will be working directly on your skin and actually start treating your deep lymphatic system first. The deep techniques of manual lymph drainage involve a specialized deep breathing technique such as diaphragmatic breathing. This helps stimulate your deep lymphatic system that actually gets the rest of your lymph system moving more efficiently. Then areas of your body that are healthy are treated first. And this is why we reroute fluid around the blocked areas into the healthy tissue, thereby decongesting your involved area of the body. When working on the limb itself, the techniques are very gentle and involve a slow rhythmic stretching. We call this a working phase, and that helps move the lymph fluid along the lymph collectors. Then there's a relaxation phase. So you'll actually feel the fluid moving out of your involved area towards the healthy parts of your body. When combined together, this technique takes approximately 45 minutes, and it's very gentle and often has an analgesic or a pain-relieving technique, or it can relax you. You may even fall asleep during this technique. At the end of your regular MLD session, your therapist may employ some deeper techniques to break up fibrotic tissue, which is a scarred tissue that can accumulate in your limb. And these techniques will help reduce that. There are medical reasons why MLD is not performed. These include any condition that would have fluid move back onto your heart or your kidneys, such as congestive heart failure or acute renal failure. It's very important that you tell your therapist about any new or changing conditions every time you come in for treatment, and this will be assessed by your therapist and your physician to make sure it's safe for you to receive treatment. Other things aside from heart failure, kidney failure include an acute DVT or any acute infections.
Yeah, so she didn't touch on there, but the big reason why you don't want to do manual lymphatic drainage when you have, say, like an infection or a DVT is you don't want to spread that. You want to make sure, say, if you have an infection, that it's resolved prior to doing lymphatic drainage, because again, if it's sitting in one part of the body, we don't want to risk moving it. And same with the DVT, you don't want to dislodge it and send it off somewhere. So that's why these are just really important precautions to consider. Things like congestive heart failure, just in my experience with a cardiologist, okay, it is possible to treat patients with those kind of things, but again, it's a case-by-case basis, depends on your medical history, and again, always, this isn't something I don't make an executive decision on this. You know, we have to collaborate with your primary doctors to make sure that it's safe for you. I won't get into this too much, but basically is what she was saying. You typically start with diaphragmatic breathing. Diaphragmatic breathing, I'll go into it a little bit, is basically belly breathing. So you breathe in through your nose, you let your stomach expand, and you do a long exhale through your mouth. And it really helps do like a pump action on your abdominals, where again, it's one of those main lymphatic drainage highways, like she was saying, your deep lymphatics. After that, you stimulate the abdomen, and you stimulate the, like I was saying earlier, those lymph node chains that you have all around your body. And then you start draining. So compression garments are, again, like it's manual lymphatic drainage is incredibly useful, incredibly helpful, and really works. But the real key to managing to promoting better lymphatic health and helping those with issues with swelling is compression garments. Compression garments, bar none, are vital for your recovery. So, and the thing is, there's so many different types. I know it gets a little confusing. Which ones are medical grade? Which ones aren't? What pressure should I get? There's a lot of good questions there. I can't answer them all for you, but I could do my best. But so first off, I'll go to my soapbox about when you get a compression garment. Please don't buy it on Amazon. I know it's the easiest way to do it, but the reality is there are compression garment brands that are more medical grade. That includes like Medi, Juzo, Sigvaris, several other ones, big makers that, again, are medical grade, higher quality. And a big part of that also is that compression garments actually have a shelf life. So when you buy on Amazon, you don't know how long it's been sitting on a shelf somewhere for how many years. And the reality is, over time, that compression, it weakens over time. So that's why even with my patients, you typically want to get a new compression garment maybe they say 6 to 12 months. Because again, it's to promote, you need to exchange it, because as time goes on, it's not going to give you the same effect as it did when you first started wearing it. And also, your limb size may change. If you're seeing reduction in swelling, you want to get resized and get one that's probably a bit more appropriate for you. You want to make sure you're washing it regularly, and when you put it on, make sure there's no wrinkles, because that will impact how it is draining. Another thing I've come across is people wearing it at night. Don't wear it at night. Or don't wear it while you sleep. Excuse me. Don't wear it while you sleep, because the reality is, when you're laying down and, for several hours at a time, you're going to be uncomfortable wearing that garment. There are, though, specific nighttime garments that I'll show you a picture in a second that has, I think, a special foam that makes it easier to wear. It's not as harsh on your body. But, and then also you want to make sure you get sized by a certified fitter. I can't really point you into the direction of one, but it is important to have someone who knows what they're measuring for, because it's really important to have something that's actually sized to you. A garment that is too big won't have the same effect, and one that's too small, it's gonna not feel comfortable. And what I say is the worst compression garment is the one that you don't wear. So it's important to get one that is fitted well. And so as you can see here, there are a lot of different types of garments. What I really like about some of these is I feel like people have an image of them being like beige and boring, but the reality is, like, with a compression garment, they have so many different colors. Even like with Lymphedivas, they have different designs, and I love them because it just makes people feel, beautiful. I think people get very caught up in, how things look, and again, it's just nice to have different alternatives that can, you could have fun with it. Swelling can happen everywhere in the body. So this is for, say, some of my patients with like throat or neck cancer or something like that. They have head compression. And then this one's interesting, the Ready Wrap. So these ones are really helpful. They're basically Velcro based. So you put around your leg and you stretch them across to do that graduated compression that you need. This is really good, especially for my patients who've had like arthritis or just, have dexterity issues with putting on a garment, like a traditional like sleeve when you think about it, or stocking. You have custom and off-the-shelf garments. Typically, if you are just like, if your swelling isn't very, very significant, then you'd likely fit in an off-the-shelf garment. But custom ones are also an option. You would have to definitely get measured for them, and it takes a little bit more time to get them. But they're, again, there are icy swelling of all shapes and sizes. And, it's just important to know that you need to get one that's measured to you. You want to wear it daily. As far as pressure levels, you have class 1, 2, and 3. It's measured in millimeters of mercury. So class 1 is kind of like your starter one. This is typically when if you're just doing this for like wellness reasons and that kind of thing, I think 15 to 20, I think class 1 could definitely work for you. Class 2 is kind of the standard I do for a lot of my patients who clearly are having issues with, drainage. Does a little bit of pressure on stage 3 or class 3, 30 to 40 millimeters of mercury. It's pretty, it's pretty tight. Those are typically for my patients who have like weeping. Basically, weeping is when your body, with your skin health kind of being affected, you kind of start draining lymph from your leg, from various like holes or cuts that may open. So that's why stage 3, that's why those higher pressure compression garments are, that's what they're helpful for. Types, like I mentioned, you have all types of varieties. And yeah, let's see. So this is something that is pretty new. It's called the Lymphedema Treatment Act, and it is going to be so important for, I think, all of us moving forward, because prior to this, a lot of my patients had to pay for these compression garments that, remember, you have to get yearly out of pocket, and they're not cheap to begin with, and custom ones are even more expensive, could be in the thousands of dollars. But with the Lymphedema Treatment Act, this was passed on January 1st of this year, or it became law January 1st of this year, where now Medicare and other private insurances are supposed to follow suit. Compression garments, compression bandages, and accessories should be covered by insurance. It's still early days for it. It will take time, I think, to get a more streamlined process for it. But to learn more, go to the lymphedema-treatmentact.org, and they have a lot of helpful information about things it covers and how you can get coverage for it yourself. I think the baseline is you need a diagnosis of lymphedema or something related, and that's the place where you start. Is once you have a diagnosis, then you can get reimbursed for these compression garments. And again, this covers nighttime garments, this covers custom garments. It's really just fantastic, because that was, prior to this law becoming the thing, that was probably the biggest hindrance I experienced, was my patients not being able to get the critical tools they need to manage their symptoms. So this is awesome. Definitely spread the word. And yeah. Compression pumps are another component of lymphatic health, lymphatic drainage tools that really make a big difference. I wouldn't say as much as the garments, but still very, very helpful. And what's great about it is by going to therapy and so forth, insurance can cover these as well. Of course, it depends how much they cover depending on your insurance, but it's just, again, another tool in our toolbox that we can use to manage symptoms. So let me put this on. So just really quick. So with these compressions, you want to make sure that, your lymphedema therapist or whoever is, kind of walking along with it. So you know what the appropriate pressure is you want to do times a day. Typically I tell my patients once or twice a day, either morning or morning and evening. And it's really just a good boost. I'll play the video and you'll learn more.
Home management with the LymphaPress sequential compression device is easy and effective, saves clinical visits, and increases patient compliance for better results. The LymphaPress sequential compression device has a rapid inflation that imitates the body's natural lymphatic flow and reduces treatment time with an upper pressure limit of 80 millimeters of mercury, making it patient-friendly for use at home.
Oh, that was it. Yeah, so that's kind of, we don't want to play that again. Yeah, so here are just various types. They have them for your legs and your arms, but they're both good. These are just several of the brands. You have like the LymphaPress here, which again, it maybe does a little bit more pressure, and some people like that more, but again, it's all of them, both of them are very, very effective. You have your Koya day spring, which I love as well because it's something that's mobile. You can wear it on the go. And especially for, say, people with kids or things like that, it can be, again, just a very, very important in managing your symptoms day to day, especially if you're doing a lot of, if you're using your arms a lot and moving, it's a good way to help manage your lymphatics. I think I already had it on this one, but yeah, basically you can adjust the pressure, you can adjust how long it goes on for. And yeah, you have there's different levels of chambers, but I won't get into that. And then now we're going to start going to some of the helpful tools I've come across, as I've worked doing lymphedema therapy. So one of the first ones I really like, they're called swell spots. And they're basically special contoured foam that you can wear under a compression garment. So like this one right here, this is for your breast. So especially after like radiation, things like that, often my patients have a little bit of swelling in the breast region, say if they had a lumpectomy. They could wear their, say, their compression bra, and you put that underneath, hold it in place, and it has those special channels right here that help kind of passively drain. So it's a good little boost, and I love how it's contoured to fit various parts of the body. They have more than just this one. They have several other ones, like varieties and shapes that, again, I think are great. I think they're a fantastic tool. Another one that I recommend pretty often is called a pit pack. Pit packs also are they have different shapes and sizes. But essentially what they are is they're cherry filled it has like a special foam with like cherry pits in them. And it's really, really good for breaking up some of that really tight fibrosis in your arm. So again, that's like where like the fluid is your arm's very tight, things aren't moving very well. You don't wear it very long. You put it under your compression garment for about 15 minutes, and then you take it out, and it's really good at just kind of softening things up. So definitely recommend that one. A stress ball. So a stress ball is really good for, especially my breast cancer patients. When you have fluid in your distal parts of your extremity, so in this case, like your hands, that using a dollar store stress ball is really good because your muscles are contracting and relaxing and helping promote that passive movement. So it's something that you could do easily while you're watching TV. Just grab a cheap stress ball and it will definitely help with your lymphatics. Comfort sling. This is also for those going through like post radiation, and it's helps lift the breast from the bottom aspect of it. And it's really good because oftentimes when patients get chafing at the bottom aspect of their breast against their torso, and this one kind of helps give it some air. So that's really that's been very helpful. Velcro compression, just to talk about it again, it's really helpful because some people just have trouble with, again, putting the garments on, taking them off, and this is typically a little bit easier on them. A leg bolster. Leg bolsters are really good for when you're like laying down at home. Basically, they elevate your limbs, so it promotes better passive drainage. Because gravity has its role as well in helping move your lymph around. So a bolster doesn't have to be anything expensive, but very helpful. Reduction kits, they don't really fit in here in the same way, but their purpose is for individuals with extreme swelling. Basically, they are it's like elastic kit that is very much cut into like strips that it's customized to your body, and you'd wear it during the intensive stage of like lymphatic, lymphedema therapy. Just worth putting it on there. Toe caps I also enjoy a lot. They do a little bit more compression toward your forefoot and toes. They are very low profile, and my patients, especially who get a little bit of lingering swelling in their feet, find it very useful. General do's and don'ts of with your lymphatic health. Drinking water, it's really important because when you're drinking water, you're promoting that better circulation. You're helping trying to filter that bad lymph out, and that, again, it's a cycle that you're trying to promote with that drinking of keeping hydrated. Regular skin checks. So if you notice that you're like, say, if your skin's getting a little bit scaly, maybe it's a little bit tough. You might even have weeping. It's important to just take a look at it And if you think there's an issue, just go to your doctor, go to your primary or oncologist or whoever, and, just get a referral for lymphedema therapy, because it's really helpful. You gotta just know who to ask. Compression when flying, it's a well-known fact that, elevation promotes swelling. So wear your compression garments on the airplane or when you're somewhere with high elevation. Moisturizing your skin, also very important. As we're saying, with when you're holding fluid in different parts of your body, it can impact the skin health. So how we help go against that is moisturizing. It doesn't have to be anything fancy, even like a CeraVe or a Vino. It's something mild that can help keep the skin strong, because that is going to help us prevent breakages in the skin. And again, we want to keep everything as tight as possible. Take your own measurements. This is also for individuals who are especially are noticing swelling throughout their days, and they are able to kind of track it and see what kind of events, what kind of activities they're doing that maybe is promoting more swelling than others. Maybe you're using your arm for a certain activity too much, or what have you. But I just suggest with lymphedema therapy, we take regular measurements as well. But when you're at home, it's good to keep track of it on your own. Limit your salt intake. Salt promotes swelling. So stick to a low salt diet. Eat your greens and veggies, and just reduce how much processed food you're eating. Let me see. I touched on it earlier, but avoid like saunas and jacuzzis. They promote swelling. I had a previous talk here a few weeks ago, and I mentioned infrared sauna. From my understanding of it, it's more helpful for you than a traditional sauna, because I think the heating mechanism is a little bit different, but I have heard literature about it impacting like breast implants and stuff. So I'm not 100% sure, but I'd say just do your own research. Again, if you have questions or you have any concerns about it, ask your doctor, or if it's like safe for you to use. Avoid wearing compression garments overnight. Avoid Amazon garments. Avoid sitting for long periods of time. And avoid having needles inserted in affected areas and limbs. Again, we don't want to increase the risk of infection. So that's why we do that. And this is kind of a rehash. Exercise daily, exercise, just moving the limbs makes a huge difference. For my patients who've had like lumpectomies or mastectomies, really just stretching your arm is really helpful. Oftentimes you have scar tissue, it's limiting your range of motion. So just trying to stretch can really help open up those channels a little bit better. Hydrate, that deep breathing, which we'll go over in a minute. Skincare, avoid tight clothing. Again, it just impacts how your body is draining fluid, and it's likely, it's a little bit more uncomfortable. Elevate, and then also stress management. So swelling could also be caused by hormonal levels. So that's why, it's just high stress can lead to swelling. Very easy quiz, but what is the lymphatic system? A network of vessels that help transport lymph, a fluid containing white blood cells throughout the body, intricate system that assists in immune function and removes cellular waste. A part of the immune system, including lymph nodes that are responsible for filtering and trapping pathogens, are D, all the above. All the above. Next one, lymphedema can disrupt your body's lymphatic system. Which analogy best illustrates the harm it can bring to your body? A breached wall, weakened defenses can allow harmful invaders that penetrate your body due to poor skin integrity. Obstructed waterway, hindered lymphatic circulation often results in fluid buildup, causing swelling wherever there's a blockage. Broken supply lines, disrupted lymphatic flow prevents essential components, including immune cells and waste products, from reaching their destination. It is D, all the above. What are the primary methods? I won't go through all of them. Lymphatic drainage, compression therapy, integrative wellness or lifestyle management put together helps create a well-functioning lymphatic system, or a better functioning lymphatic system. And last question, approximately how many people in the US are impacted by lymphedema? And the answer is D, 10 million. And I want to just throw a quick dedication. This is to my mom, Acelia Villanueva. She couldn't make it here today, but she is a breast cancer survivor. I believe she was stage 2B. She had 28 lymph nodes removed, and she was my first exposure to what lymphatic health even was, because she was very good about wearing her compression and doing what she needed to do. She had a really good oncologist. I think she was with Dr. Dickey in Torrance, and really just, again, she's an inspiration, and she's, I'm really, it's nice to have, someone that inspires you, and my mom inspires me. But yeah, those are all of my, that's like the basic slides. But if you guys, I'll turn off my screen share for now. I'll put my face back on. Hi. Does anyone have any questions? And I talk fast, I know. Yes.
I guess I'll go. I'm Francine. My hand is up.
Hi, Francine.
Hi. How many sessions does one usually need in the treatment?
Fantastic question. So I hate to say it, but it depends. Typically, with my patients who have more severe swelling, I often see them like 2 times a week, but it really depends for, like, we'll say like for 4 to 8 weeks. But I've had patients who are on for upwards of like half a year. It really depends on the individual and how significant your swelling is and how pervasive it is. Again, it's impacted by your prior medical history. And again, there's just a lot of factors involved. Typically, after an evaluation, on the lower end, I may see a patient 2 to 4 times, and that's pretty effective. It kind of depends on the reason why. Again, if you have like a lymph node removal or something, it's going to require continued management more than likely. But yeah, hopefully that answers your question. It kind of varies, but it could basically go from several weeks to months. And
okay. Yeah, okay. It did answer my question. And one more, blood cancers. How does this work fit in with people with blood cancer? I'm non-Hodgkin's lymphoma.
Great question, and I will have to get back to you about that. I don't have an answer top of my head, but thank you. If you could leave your email, I'll reach out to you.
Okay, thank you.
Thank you so much. Anyone else?
Belinda?
Yes, Belinda.
And my question is, is it important how many lymph nodes are removed? If it's 1, and you say that your mom had over 20, then how it affects you? And then the other part, is about taking your blood pressure on the side where you had lymph nodes removed. Is that still a no-no?
Oh, great. I'm glad you brought that up. Great questions. Yeah, thank you for bringing that up. Yes, you want to take the blood pressure as well on the opposite side. Thank you for mentioning that. It kind of like with taking your blood drawn, go for the opposite side. Your first question, I'm trying to remember it. Can you repeat it one more time?
Sorry, it had to do with I forget my question.
It's okay. It happens to me all the time.
Does anybody remember my question?
Oh, you were asking about how many lymph nodes removed. So,
yeah, okay.
Great question. So realistically, like, the more lymph nodes you have taken out doesn't necessarily mean that you're going to have worse swelling or whatnot. I have patients who've only had 1 or 2 that experience quite a bit of swelling, and I have patients who've had, again, a lot more taken out that don't have issues. It's hard to really define it to be a certain way, because the reality is everyone's a little bit different. And I know it sounds like a cop-out answer, but it's really true. Like, everyone's recovery journey is gonna look a little bit different from one another. Something to keep in mind, though, and this is for anyone who's had any lymph nodes removed, gone through breast cancer or whatnot. The reality with lymphedema, it can show up at any point. Even if, like, say, like 5 years down the road, you have had no issues, it's still possible to develop issues. Again, things like elevation. I've had a patient who was helping her friend move, and by lifting too much, it triggered swelling that, again, took months for us to get under control. So again, continued management, just learning kind of how to work it. Who's next?
Alex, there's a question in the chat, and I'll just be calling people. So the first question from the chat with using a pump for the arm, do you still recommend self-massage in addition to it?
Yeah, absolutely. Self-massage, and I was supposed to go over that. I don't think we have time, but self-massage, typically, again, it's like that gentle pressure. You're just kind of gently stretching the skin, and in this case, you're moving it toward your lymph nodes. But yeah, typically, especially in the clinic, we would do lymphatic drainage first, and then kind of as a nice added boost at the end, we do compression pumps. And yeah, so typically I think they work really well hand in hand. But you can get away with just doing the pump instead.
Marty, go ahead.
Yeah, I have developed after being diagnosed with lymphedema about 3 months ago, complete fatigue, muscle fatigue, stiffness. Yeah, so I can hardly move. I do sit a lot. I do get exercise twice a day, but yeah, I can barely doing even the physical therapy. So I went to the vitamin place. They said maybe magnesium. I'm taking that. So any suggestions for muscle stiffness?
Have you been evaluated for lymphedema?
Oh yeah. Oh yeah.
Yeah. Do you have like garments? Do you have pumps?
I had cervical cancer, and yeah, I do have garments that I do wear, compression stocks, and I do that religiously. And I do have a voter trained lymphedema therapist that I use as Medicare, Dr. Medicare will allow me. And yeah, so and also, could you put your information either in the chat or on a follow-up like email, whatever?
Yes.
Yeah, so that's my question.
I will say for now, if you could leave your email as well, and I'll reach out to you directly, and we could talk about a little bit more about what exactly you're experiencing, because without seeing it, it's a little bit harder for me to give you specific advice. But yeah, just message if you could put your email, and I'll get back to you.
Okay, in the chat.
Yeah, we'll do in the
You can direct message him, Marty. So not everyone gets it, but you can just do it directly to Alex V, and then only he will see that information.
Okay,
next
no worries.
question. Nancy, I had 45 lymph nodes removed 25 years ago. I go camping at 10,000 feet every year. Never had a problem until this year. My hand got huge. Do you know why?
Well, like I said, it could be several things. Another thing that causes swelling is just kind of as we age, basically our lymphatics and our venous system become less strong. So like that fluid return isn't as it used to be. So, I mean, it's a possibility that just, again, it could be a little bit age related, but also, again, by going to elevation, you're really putting a lot of stress on your lymphatic system to drain optimally. So, like I was mentioning a few minutes before, this could show up at any point, really throughout the rest of your life, especially if lymph nodes, especially with that significant number of lymph nodes removed. I can't give you a specific reason because, again, it could be also consider things like medications, lifestyle, what's your diet like? There's a lot of things that kind of unpack there. But I mean, definitely the first thing you do, again, see a certified lymphedema therapist. Make sure you have a compression garment that is fit to you, and that could also include like wearing a glove. That's something I didn't touch on, but they also have like gauntlets or gloves that do compression as well. But all those things, self-massage, just basically stimulating the lymph nodes and just gently pulling the skin toward the, I guess, proximally. Use like a stress ball, things like that, just to promote movement. And yeah, I mean, if you have a pump or anything, would be useful as well. But yeah, again,
Alex,
yes.
Oh yeah. If the compression garment seems to make it worse, do you know what that kind of can mean?
Well, so it's a great question. So there are actually like two types of compression garments. There is what we call flat knit and circular knit. The first thing to mention is, again, you want to make sure it's something sized to you, because it could be the right type, and if it's not sized to you, it's not going to work as well as it should, and it'd be uncomfortable and you won't wear it. But typically, like if you have pretty significant swelling, you'd want to opt for like a flat knit. It's a little bit thicker. The material is a little bit more stiff. And then you have like flat knit or circular knit. Wait, flat knit was a previous one. Circular knit is, I think, probably a little bit more common. Those are what you see in a lot of those compression sleeves, like the basic ones. But yeah, there's different types. I don't have time to get into all of them right now. But yeah, there's circular knit and flat knit. And yeah, I would say start with the lighter pressure, and then assuming you can tolerate it, you could always go up a little bit, with a higher class. But typically, 20 to 30 millimeters of mercury is a good starting point. But of course, talk to your doctor, make sure it's okay for you to wear.
Okay, next question, Kyle. Thank you for your patience.
Hi, I'll try and make it fast. There's two parts to it.
Yeah.
Okay, so my lymphedema is very mild, and it's as related to breast surgery. I've gone in, and then it improves. The fibrosis is improved, and then I ended up going back another year later because it popped up again when I changed medication. The color of my nipple completely changed in this phase of whatever I'm experiencing. So I don't know if the fibroids, if that and the lymph nodes and all that connects to the discoloration. And the second part of that question is ongoing is issues that we are not addressing in the lymphedema work that I've had done. Is where the port went in and up into the neck, where the extra tube came, was, whatever those two incisions are, causing issues up and along my ear and neck, and all, what seems to me now, I'm thinking maybe all lymph node related, maybe. But do you ever see people that have issues with that port system?
I have.
That impacts the lymph system?
Yeah, so I'm not sure if I mentioned it, but like something else that happens again post like surgery, or again even with the port where they have to open you up, is basically you could develop scar tissue that basically functions like little roadblocks that impact how things are draining and circulating. So like as part of the treatment, also we do a little bit of like scar tissue release in the area. Again, you want to make sure it's not like there's no infection or anything like that going on there. But yeah, definitely I've had patients with who've had a port who've reported similar things. As far as like the nipple discoloration, the only thing I can really think of top of my head is like the impact of the radiation. But I'm not 100% sure, to be honest. But no, great questions though. Thank you. And again, anyone, you can just feel free to like email me. We have my email in the, I think we'll do a follow-up one. Just feel free to email me if you guys have any questions. But yeah, I could take a few more.
Jennifer, go ahead. Jennifer, you're on mute.
Sorry.
It's all good.
I'm 26 years out of breast cancer, and I've had a double mastectomy and radiation and all that good stuff. I have been probably for the past 16 years had cellulitis, and I get it like every 2 months or 3 months. And then sometimes I go without it. And then all of a sudden it's like every now and again I get leakage. Like if I shave under my armpit, or if I get a scratch on my arm, I get lymphatic fluid coming out that can last for like 4 days.
Yeah, I actually have a patient right now that's having similar issues. They basically like cut, having that kind of like lymphatic drainage that kind of came up or that weeping that came out unexpectedly. For one thing, if you have an area of concern, you can always like check out wound care at your local,
yeah, I've done that.
Yeah, that's a good place to start, just to, again, make sure there's no infections. It's good to have an extra set of eyes on things. But also, this is where like compression bandages or compression garments, I don't know if you wear them, but that really helps as well, because with it giving you that tighter compression, it's allowing the tissue to heal a little bit better, because it's basically promoting better circulation.
I did do that.
Yeah.
But it promoted more leakage.
It did more. It could also be the class of compression. So typically with people who have had a little bit more swelling, they need a little bit higher. So like 30 to 40 millimeters of mercury. That's like a stage, like the highest stage lymph garment. But it's a little bit tricky, because I think it sounds like you've been pretty on top of it. Make sure you're moisturizing, and drink your water. But yeah, I mean, if you have, I definitely love to talk to you offline from this. But yeah, feel free to message me, and we could talk a little bit more about through. Okay.
Thank you.
You have time
of
for a
course.
couple more questions, Alex?
Yeah.
Okay, just a few more, just from what's in the chat. Do you also treat venous insufficiency in my ankles?
Oh, absolutely. I didn't really mention that. Yeah. So oftentimes, venous insufficiency can, basically your circulation isn't optimal. So you're retaining fluid often in your legs or what have you. But yes, lymphatic drainage is incredibly helpful for managing those kind of symptoms. So yes.
Our participants would love to see more of you. Could you do another session just showing the self-massage, the lymphatic drainage massage only?
Yeah.
Yeah.
Yeah, go ahead. You could, yeah.
Yes. Do you think vibration machines like LifePro that you stand on are effective for draining lymph glands?
I like that question. This is something I've kind of learned about recently, but I've heard from previous patients that rebounding therapy is actually pretty helpful. Again, it's not something I've ever done. It's just more from word of mouth. I've heard it's been helpful. Also aquatic therapy. So swimming is also really helpful for your lymphatic health as well. I've had patients, especially my breast cancer patients, who do a lot of swimming. Really helps them with their symptoms. And to the previous question about workshop, I think we're doing a workshop on the September 20th.
September 20th in person.
Yeah.
So for those who are in the area in South Bay, Alex will be back again with the same workshop on September 20th. But hopefully we will maybe chat about doing a lymphatic drainage massage specifically. But do you have a YouTube video, or do you recommend someone on YouTube that's showing the lymphatic drainage so that participants can work on it, on their own now?
Top of my head, I don't. I definitely need I'll probably in the coming months, I'll probably produce something. Yeah, because there's not a lot out there. I'll definitely take note of that, and you guys will be the first to hear it. But yeah, I definitely would like to do something like that.
Wonderful. Well, thank you so much, Alex, for being here with us today.
Yeah, no.